an introduction, ADHD or attention deficit hyperactivity disorder. It's a disorder that is marked by an ongoing pattern of inattention and or hyperactivity, impulsivity that interferes with functioning or development. Oftenly is diagnosed around the age 7, but severe cases can be diagnosed around age 4. So this PowerPoint will go over the basic pathophysiology, nursing diagnosis, nursing interventions, and then treatment and evaluation.
Pathophysiology. This is Rahma. ADHD is associated with a problem in neurotransmitters. We will explain how neurotransmitters work. For better understanding, then we will proceed to the pathophysiology. The neurotransmitters dopamine, DA, and norepinephrine, NE, are implicated in the pathophysiology of ADHD. Brain studies on individuals with ADHD suggest defects in the dopamine receptors, D4, receptor gene, DRD4, and overexpression of a dopamine transporter 1, DAT1. The dopamine receptors gene, DRD4, uses dopamine, DA, and norepinephrine, NE, to modulate attention and responses to one's environment. The dopamine transporter protein takes DA and NE into the synaptic nerve's terminal. At the terminal may not have sufficient interaction with the postsynaptic receptors. As a result, one lacks attention. Okay, here is the neurotransmitters, how they work. Norepinephrine is for alertness, concentration, and energy. Serotonin is for obsession, compulsion, and memory. Dopamine is for pleasure, rewards, motivation, and or drive. Norepinephrine and dopamine, that's the main part that we're talking about today. It's for attention. Dopamine and serotonin is for appetite, sex, and aggression. Dopamine plus norepinephrine and serotonin, they help with the mood and cognitive functions. What does ADHD look like in a young child? Inattention, difficulty attending during cycle time, minimal progress, learning letters and numbers, difficulty following directions and remembering rules. Hyperactivity, running, jumping, climbing off furniture, unable to stay seated, loudness, noise making. And impulsivity, difficulty keeping hands to self, consistently blurting out, difficulty waiting and easily frustrated, running out into traffic. Pop quiz. We have 2 questions. Pop quiz. Number 1. The receptors of the neurotransmitters used to modulate and response to one's environment. A, attention, B, anxiety, C, aggression, D, alertness. Question 2. Which neurotransmitters are implicated in the pathophysiology of ADHD? A, dopamine and serotonin. B, dopamine, norepinephrine, and serotonin. C, norepinephrine and serotonin. D, norepinephrine and dopamine. Next person will talk about examples of normative attention, activity, and impulsivity.
I want to show you a couple of examples to give you a sense of what normative versus atypical levels of these types of behaviors look like in young children. In both these examples, they're a set of twin girls who are 3 years old. So here, you can see the child focusing in on and persisting through complicated tasks, even though they are difficult. She shows interest in activities, and although would clearly like to touch the items the examiner is holding, she is able to wait through the demonstration of the task for her turn, rather than intrusively grabbing the items from the examiner's hand. In this example, we are going to demonstrate what reduced attention with high activity and high impulsivity is. In this particular example, you can see that the child is distracted by her environment and has difficulty paying attention to the task being asked of her. The examiner has to repeat tasks and instructions and initiate reinforcement strategies in an attempt to obtain the child's attention. The child has a hard time with all the familiar and unfamiliar objects around her and is showing signs of inattention through difficulty following directions and impulsivity through difficulty keeping hands to herself and waiting for her turn.
Nursing diagnosis. In this picture is a scale of statistic on diagnosis. You can see from ages 2 to 5-year-old, there are 388,000 children diagnosed with ADHD. Again, there are ages of 12 to 17-year-old, 3 million children diagnosed with ADHD. And on the bottom, you can see there are 6 to 11-year-old of 4 million children diagnosed with ADHD. With ADHD, children has impaired social interaction related to developmental disability hyperactivity, altered thought process related to personality disorders, risk for injury related to psychological, defensive coping related to feelings of inadequacy and need for acceptance from others, risk for parental raw conflict related to children with attention deficit hyperactivity disorder, risk for delay in growth and development related to mental illness, hyperactivity, lack of concentration. Pop quiz. Question 1. Methylphenidate is prescribed to an 8-year-old child for the treatment of attention deficit hyperactivity disorder, ADHD. The nurse will most likely monitor which of the following during the medication therapy? A. Deep tendon reflex. B. Intake and output. C. Temperature and breath sounds. D. Height and weight. Please give me the answer. Question 2. The school nurse assess Brooke, a child newly diagnosed with attention deficit hyperactivity disorder, ADHD. Which of the following symptoms are characteristic
of the disorder, select all that apply. A, constant fidgeting and squirming, excessive fatigue and somatic complaints. C, difficulty paying attention to details. D, easily distracted. E, running away. F, talking constantly even when inappropriate. Please give me the answer.
Next, we're going to be talking about nursing interventions. So some nursing interventions are, you want to accept and consider the child for what him and her is and communicate with them as an equal. You want to make sure that you talk to your child age appropriately and do not baby talk them. Encourage the child to express his thoughts or emotions and respond therapeutically. Give the child simple instructions at a time. Fulfill a scheduled routine every day. Avoid distractions to prevent hyperactivity. You want to make sure to give praise for accomplishments. Children really do work best that way. Encourage the child to join a physical activity and help him or her exert some energy. And lastly, you will want to try deep breathing and stretching in the morning and before bed to help exert energy as well and promote focus. So some nursing assessments include clinical examination. This aims to identify the presence of other illnesses with symptoms that overlap those of ADHD. This typically involves inspections for vision and hearing impairments, neurodevelopmental immaturity in relation to growth and fine motor functions. Also, extensive interviewing will take place by the healthcare professional, along with relevant family members, partners, teachers, and friends to observe the behaviors in many different settings. Next is observations. For children and adolescents, teachers in particularly may be especially well placed to identify symptoms of ADHD in children and support symptom reports from parents. Lastly is a rating scale, which is a number of rating scales are available to kind of help assess general behavior and psychosocial functioning of ADHD. So a pop quiz for this section. ADHD is characterized by, select all that apply, inattentiveness, B, overactivity, C, impulsiveness, D, inability to sit still, E, all of the above, or F, choices A and B. Next question is, Ritalin is the drug of choice for children with ADHD. The side effects of the following may be noted. A, increased attention span and concentration. B, increased appetite. C, increased sleepiness so they can sleep throughout the night. D, to help increase their vitamin intake so they can be more balanced throughout the day and focus. And I will let you guys answer those.
This is the treatment section for ADHD. So the medical medicine side, there are some options, and they are stimulants, which help increase the neurotransmitter levels, cognition enhancing medications that improves the mental function, and antihypertensive drugs that help lower blood pressure. There are some lifestyle changes that the parents can help the child to help accomplish for treatments, such as limiting the total screen time each day to 1 or 2 hours, which includes like iPads, televisions, etc. encouraging physical activity throughout the day, improving bedtime routines every day, every night, drinking water rather than other beverages such as soda, juices, and eating healthy, balanced meals. There's also holistic treatments that are out there, which include support groups that are for counseling and shared experiences, cognitive behavior therapy, anger management, and these are for helping modify negative thoughts, behaviors, coping mechanisms, and avoiding destructive emotional outbursts. And there's also other resources such as counseling, psychology, psychoeducation, family therapies, and applied behavior analysis. Pop quiz. So for the first question, it asks, of the medications listed below, which one is not an example of a type of medication used to treat ADHD? A, stimulant, B, cognition enhancing, C, anticoagulant, or D, antihypertensive. The second question asks, which lifestyle change would be recommended to help treat a child with ADHD? A, drinking a Coca-Cola, B, eating a healthy, balanced diet, C, sitting in front of the television for 5 straight hours to help the child relax, or D, eating a candy and junk food. So go ahead and answer those questions.
What is ADHD? It's a disorder that can cause hyperactivity, impulsivity, or inattention. The cause is unclear, but it's thought to be caused by problems with the dopamine receptors in the brain. And then symptoms, they have problems following instructions, paying attention, being easily distracted, interrupting others, running or climbing at the wrong times or places, talking too much, forgetfulness. They have disorganization, inability to play quietly, restlessness. And then I found this quote, and it's from Dr. Jim Carrey. It said, my report card always said, Jim finishes first and then disrupts the other students. I thought that was a good quote. How would my child be diagnosed? Diagnosing ADHD can be difficult as symptoms can come from the environmental factors that the child is in. The doctor will include teachers, the psychological testing, physical and neurological testing to help attain the diagnosis. Some medications, so they would maybe give like a stimulant, like Ritalin, and increases the neurotransmitter levels, the heart rate and blood pressure, decreases appetite and sleep. He might give cognition enhancing medication, improves mental function, lowers blood pressure, and may balance mood. Then they might give some antihypertensive medication, which will lower the blood pressure. I put down some lifestyle changes. So no more than 1 or 2 hours of total screen time a day that's recommended. You want to encourage physical activity, maybe sports, stuff like that. Improving bedtime routines, drinking water rather than other beverages. You want to have them eat a healthy, balanced meal. And then I found this to do's and don'ts charts. Underneath the do, you want to have break the big task into manageable and detailed ones. Create a simple and practical routine for them. Limit distractions and make them invest in beneficial activities. So like playing outdoors is really good for them. And then you want to have a fixed sleeping pattern. Some don'ts would be limit their exercise or make them sit for a long time. Discourage loud thinking. Be negative, angry, or criticize them. And then give them hard and complex tasks. How can I help my child? So some suggestions are maybe some support groups, other parents, other children dealing with ADHD. cognitive behavior therapy, anger management, counseling, mental health education, family therapy, or behavior education. Other ways to help the child: accept and consider the child for what he is and communicate with him as an equal. Do not use baby talk. Talk to your child age appropriately. Encourage the child to express his thoughts or emotion and respond therapeutically, and then give simple instructions at a time. And then we have another quote. The best way to think about ADHD is not as a mental disorder, but as a collection of traits and tendencies that define a way of being in the world.
Of a patient and what that should include. So implement appropriate memory retraining techniques, such as keeping a schedule on a calendar and writing a list. Encourage talking through feelings of frustration, helplessness, and so forth. Refocus attention to areas of control and progress. And lastly, monitor the client's behavior and assist in using stress management techniques. So next, I want to share with you guys a video that of one of our participants and some ways that she found to be helpful with her 3-year-old who has ADHD.
This quote from Dr. Edward Hallowell stated, "The best way to think about ADHD is not as a mental disorder, but as a collection of traits and tendencies that define a way of being in the world."